Hi everybody, my name is Jaden Ferry, and I did my genetics presentation over hemochromatosis. I find a lot of interest in this. It's one of the more common genetic disorders, so let's go. What is hemochromatosis? So hemochromatosis is known as the excess storage of iron in the human body. Um, as you will know, the body has no way of excreting an excess amount of iron. This is why it is stored in organs such as the liver, heart, and pancreas. Those are the three organs that are primarily stored for iron. A lot of this storage can actually cause toxicity and some diminishing of those organs. So hemochromatosis is divided into four different types. Type 1 is known as the classic hemochromatosis. It is one of the most common genetic disorders in the US, and it affects about 1 million people. Men will develop this at ages of 60 to 40, in between those ranges, and women will develop this after menopause. It is caused by a mutation in the HFE gene, which we'll talk about later. Type 2 is known as juvenile onset disorder. This is mostly because it is found in kids. By the age of 20 of these individuals, they will have decreased or absent secretion of sex hormones. This affects puberty in males and menstrual cycles in females. This can become potentially fatal after age 30, and this will induce heart disease, which can kill the individual. Mutations in the HJV or HAMP genes are the main cause for type 2 hemochromatosis. Type 3 is an intermediate between type 1 and 2, and it is known to be caused by mutations in TFR2 gene. Type 4 is developed in the same time frame as type 1. Symptoms are very similar, and it is known as Ferroportin disease. It's known for its mutation, the SLC40A1 gene. Symptoms of hemochromatosis. So not everyone actually experiences symptoms with hemochromatosis. Some can be a lot more subtle than others. Most of the symptoms can be linked to other diseases that people can have, but some of the most well-known ones are joint pain, fatigue, weakness, weight loss, abdominal pain, and loss of sex drive, which as from type 2 can be linked to the absence of the secretion of the sex hormones, which can cause one of these symptoms. If these symptoms escalate and become worse, other issues may arise. Things known as heart abnormalities, liver disease or cancer, arthritis, diabetes, and skin discoloration are all found in patients that experience this for long periods of time. So how is hemochromatosis diagnosed? Many of the main things that providers will do is blood testing. Some of these blood tests are just considered iron panels, serum for iron, serum for ferritin, which the ferritin is the amount of iron contained or stored in the body, or a total iron binding capacity test can be done, which this tells us how well body can bind to iron. So how well your cells are going to take in iron, how it will bind to it. Other things that are considered is, of course, genetic factors. Hemochromatosis is hereditary. So as we mentioned, for type 1, most commonly due to the HFE gene mutations. These mutations are known as C2824 and H63D. Those are two of the most common mutations of the HFE gene, and it will lead to hemochromatosis. So it is known that if you inherit two of the abnormal genes, you are more likely to get hemochromatosis, and you will pass it on to your children. As we talked about symptoms before, those symptoms can be more prevalent in some children or in late in adulthood than others. So it's also known if inherited only one of the abnormal genes, you're less likely to get hemochromatosis, but it is still possible for you to pass those mutations onto your children, and they can inherit hemochromatosis later on in life. So treatment for hemochromatosis is just as you would expect. such things as iron chelation therapy. This can be drugs that will remove extra iron from your body. One of the more known drugs is deferoxamine, but some of the symptoms for taking this drug can cause nausea, diarrhea, rash, and vomiting. So there is, of course, symptoms that can arise from just taking the medication for this type of therapy. There is therapeutic phlebotomy. This is very similar to blood donation. So you donate blood, get rid of some of the blood cells that are carrying extra iron. And the only difference from this to regular blood donations is this is under a doctor's order or prescription. Also, hemochromatosis diet is highly recommended for patients. Most foods contain more iron than others. As well known, red meat such as beef, venison, lamb, and buffalo are known to carry more iron than other foods that can be healthier for someone who's diagnosed with hemochromatosis. This is the works cited page, and that's all I got. Thank you very much.